Hello, this is a mock lecture recorded. So I'll start now with my screen shared for the lecture. So yes, this lecture is an online lecture in relationship to nutrition and phenylketonuria deficient patient. The audience for which the lecture has been delivered is undergraduate students who would be studying nutrition and dietetics. So moving on. So students, I would first request you to complete an online Google quiz. This quiz is to just assess your pre-reading, your understanding of your pre-reading. No, this is not an assessed activity. You're not going to get any marks for it, so don't worry. But yes, this is to gain your understanding, whether you have understood your pre-readings clearly or not. It doesn't take a very long time, just a matter of 3-4 minutes. I would be very grateful if you can complete this. Any doubts, please get back to me in our walk-in hours or in our hours where you can call me up, which has been provided previously in lecture 1. So today, what are we going to cover? We will be covering various topics in relationship to phenylketonuria, which is its metabolic pathway. Now, phenylketonuria, the abbreviated term is PKU, and that is what I'll be generally using in this lecture. So we'll be covering metabolic pathways of PKU, symptoms, management, classification, nutrition and PKU, particularly PKU in relationship to intact or dietary protein. Dietary protein is also called as intact protein, and PKU in relationship to medical foods. And then lastly, PKU and the current research which is ongoing in our university. So yes, as the name suggests, phenylketonuria. So this disorder is about phenylketonuria deficiency, right? So what deficiency are we particularly talking about? We are talking about the deficiency of an essential amino acid which is called as phenylalanine. The deficiency of phenylalanine is what leads to phenylketonuria. This is an essential amino acid, meaning it is obtained only from the diet. Now, majority of the people like you and me, we can metabolize phenylalanine. Phenylalanine in the entire lecture is abbreviated as Phe. So this is how I'll be referring phenylalanine to, meaning Phe. But there are certain people who cannot metabolize phenylalanine. Why is that so? This could be because they have either a deficiency, or meaning the enzyme or the cofactor which is required in metabolizing phenylalanine is limited, or else the enzyme or the cofactor may be completely missing. Now, which enzyme and cofactor are related to PKU? The enzyme being phenylalanine hydroxylase and the cofactor being tetrahydrobiopterin, which is also called as BH4. I'll be talking about both of these enzyme and cofactor in the coming slides. So basically, when you have a limitation of the enzyme or cofactor, or if it is completely missing, then what happens? Then the blood Phe level increases. It increases to such an extent where it crosses the blood-brain barrier, meaning high Phe level in your brain, which causes neurotoxicity. What are the signs and symptoms of PKU? We'll also be going over that. Now going over the metabolic pathway. So what happens to phenylalanine in our body? What is the metabolism of phenylalanine? Phenylalanine in the body is broken down to tyrosine. Now the breakdown of phenylalanine to tyrosine is supported by the enzyme phenylalanine hydroxylase and the cofactor which is tetrahydrobiopterin, which is BH4. Now in PKU patients, you may have the enzyme and cofactor completely missing, or else there could be a deficiency of the enzyme and cofactor. And therefore, phenylalanine is not converted to tyrosine how it would be converted in populations like you and me who have phenylalanine hydroxylase and tetrahydrobiopterin. So now what happens in PKU patients? You do not have this conversion happening, meaning you have high blood levels of phenylalanine, and you have low levels of tyrosine. Now, this can lead to various repercussions. What are they? So, high tyrosine level. Now, tyrosine, if it is high, meaning if it is normal, it has various other physiological functions that it supports. But in PKU patients, as we know, the blood tyrosine levels are low because you are not getting sufficient amount of tyrosine from phenylalanine conversion. This low tyrosine level leads to or can affect the functioning of synthesis, production, and activation of melanin. Now, melanin is the pigmentation which gives skin coloration, hair coloration. So, in PKU patients, you have these pigmentations which are reduced. Now, in relation to sleep, which I have mentioned over here, that is in relation to the synthesis and activation of serotonin. Serotonin is produced less because you do not have tyrosine to the sufficient level, and therefore you have sleep disorders, sleep issues. Then tyrosine is also important for the activation of thyroid hormone. And we all know that thyroid, as we learned in the previous lecture, has very close relationship with weight regulation. So in PKU patients, you could have extremes, which is failure to thrive or cachexia, or else undernutrition, or else the other end, which is overweight and obesity. Now, with relation to catecholamines, what are they? They are hormones such as epinephrine, non-epinephrine. You have your dopamine, even serotonin. So all of these hormones, they are not functioning, synthesizing, activating to the best possible level that they should be in a normal person, in a healthy person. Therefore, you have neurological function issues, and therefore you have neuromotor muscle function issue. That is, the gait or the walk of a PKU patient could be different because of the motor neuron regulation issues in comparison to a healthy person. And because you do not have sufficient amount of serotonin, dopamine, therefore you could have mood and regulation issues such as depression, stress, anxiety, so on and so forth. Now, with tyrosine being synthesized not to the appropriate amount, these leads to less production of intermediates of your Krebs cycle or your energy cycle, which we had learned in one of our lectures, right? So when you do not have sufficient amount of these intermediates in your energy cycle, Krebs cycle, TCA cycle, this leads to less energy, apathy, lethargy, fatigue, so on and so forth. Now, after understanding the metabolic pathway, I have summarized these symptoms over here. Now, students, what is important to understand is rather than just memorizing the symptoms of PKU, what I did in the previous slide was to help you understand why are you having these symptoms in PKU which you are having. You're having these symptoms because these symptoms are actually related to the production, the availability of tyrosine, and the presence of high phenylalanine. So over here again, just to summarize these symptoms, yes, you have depigmentation, and now you know why. It's because of low melanin synthesis. Therefore, you have pale skin, fair hair, etc. You have developmental delays, and you also have anthropometrical disorders or issues such as being failure to thrive or obesity. You have cognitive impairment, mental disabilities. While the infant is born, you have a small head size, which is called as microcephaly. There are also skin issues seen. In biochemical tests, you will see that when you have high Phe level, when it reaches the point of saturation in the blood, then Phe is then thrown in your urine. And therefore, you have high Phe compounds molecules found in the urine sample. And because of the Phe smell, Phe is the compound which gives you the musty odor of the urine, smelly urine in a PKU patient who has untreated or unmanaged blood Phe levels. Then we also spoke about the neurological symptoms. And now we know why a PKU patient is suffering from neurological symptoms, because of neuromotor disorders such as related to your catecholamines like epinephrine, non-epinephrine, so on and so forth. So now, for best results, an infant born in the first 3 weeks of diagnosis that the infant has PKU, the treatment should start. It should start within first 3 weeks of age or of birth. Why? to prevent any neurological and cognitive disability, because high Phe level in the brain can cause damages which cannot be reversed back. So to prevent it, the treatment should start as early as possible. And therefore, you have diagnosis of Phe happening as soon as the infant is born in the hospital. You have a toe-pick test which is happening, which is a part of newborn screening. And the newborn screening information will be covering in our forthcoming lectures. What is newborn screening and what are the various metabolic disorders which are encompassinated into newborn screening. So it is not part of this lecture, but I'll be covering it in the future, in my future lectures. Now the management of PKU, yes, it requires lifetime management. Diet plays a very, very important role in successful management of PKU. Like with any other health disorders, you require frequent blood tests and very close clinical monitoring. The diet management, diet therapy management, medical management of diet therapy includes two important components. First being medical food intake. Medical food intake in very simple terms is supplements. So supplemental intake. And then second being your dietary intake, which should be low in proteins, which is your intact protein. Now, what is the difference between the protein of medical food intake in comparison to intact protein intake? In medical foods, you have protein which is available in its most elemental form, which is it is already available as amino acids. So the body doesn't have to break down the protein into amino acids. In medical food, you have protein available as elemental amino acids. But in natural food, in nature, the food which we eat, you have protein which is available in an intact form, meaning the body will have to break down protein into amino acids. And therefore, the protein in food is called as intact protein, whereas the protein in medical food is called as elemental amino acids because of the way it is being available. Now, the medical therapies involves giving them enzyme therapy. Enzyme therapy, which are most successful and ongoing, are the PKU therapy. PKU therapy is where you give the cofactor, tetrahydrobiopterin. You give PKU in form of a powdered supplement, which the individual can have it with water or with milk or with their medical food protein. So if an individual has deficiency of cofactor, they are generally put on PKU to see if this is helping them in their treatment. Now, what is PEG-PAL over here? PEG-PAL is when you're giving a synthetic form of the enzyme phenylalanine hydroxylase. You give it in the form of phenylalanine lyase. So you're injecting the enzyme in a synthetic form and seeing if that is helping the patient. We will be talking about the diet therapy around this and at a very brief overview level. So now moving on with the classification, like with any other disorder, you have PKU which could be mild PKU ranging to moderate to severe. And what defines mild, moderate, severe? It defines the blood level of PKU, which is greater Phe level in your blood may be reflective of severe PKU. Low Phe level in your blood may be reflective of mild PKU. And remember, this is a genetic metabolic disorder, meaning if an individual is severe or mild depends upon the genetic mutation which has happened. Because PKU is a genetic disorder, if your genome or the genetic is in a way which reflects severe PKU, you will be diagnosed with severe PKU. At that time, you may have high blood Phe levels, but with proper dietary management and medical management, your blood Phe level can then be brought down to an acceptable level. But the main concept behind this diagram, which I want to show you, is that yes, there are classifications of PKU ranging from mild to severe, but at the same time, severe the PKU, more restricted is the diet. Similarly, milder the PKU, less restricted is the diet, which is closer to a normal diet. Now, what do I mean by restriction? Remember, for instance, I'll use an analogy over here. in diabetes, for example, what do you need to restrict? What is the main nutrient you need to regulate is your carbohydrate. So in diabetes, you need to regulate or monitor your carbohydrate intake. Very overview speaking. Then with hypertension, you need to monitor your sodium intake. Similarly, with PKU, you need to monitor your protein intake because phenylalanine is an amino acid, and amino acid is a component of your various other proteins. So in PKU, when I talk about dietary restriction, it is restricting the amount of protein the individual is consuming. That is restricting the amount of Phe the individual is consuming in the diet. Now, according to the guidelines, according to the American Dietetic Guidelines, the goal is to maintain your blood Phe level between 3 to 6 milligram percent. And to achieve this, you need various levels of dietary restriction depending upon the type of PKU the person has and the regulation, the blood Phe level that the person is maintaining. Moving further, now what are the recommendations? So 1 gram of protein gives you approximately 50 milligrams of Phe. All right, so now according to the guidelines, the national guidelines, what has been suggested for children 4 years and beyond up to adulthood, the Phe intake, that is the dietary Phe intake, should be between 200 to 1100 milligram per day. This roughly translates to 4 to 22 grams of protein, meaning in the diet, they should not have more than 22 grams of protein from the intact protein, dietary protein. Now, if you see, all of this is done to maintain your blood Phe level 3 to 6 milligram percent. Now, whether a PKU patient is allowed to have 20 to 22 milligram of protein or whether the PKU person is restricted and can only have 4 to 6 milligram of protein, it all depends upon the type of PKU the person is suffering from, which is severe or moderate or mild, and the control the person is maintaining, which is the blood Phe level. Now, the interesting irony in this condition is that the overall protein intake, that is the protein which is coming, the entire protein which a PKU person is ingesting, it should be 120 to 140% more than the DRI for age. So now, for instance, for an adult male, I have given an example over here. Just an example, if an adult male who is 31 years of age, healthy adult male, doesn't have PKU, now that person is required to have approximately 56 grams of protein per day for regular maintenance, wear and tear of the body. So this healthy person will have 56 grams of protein. But if you had a PKU patient who was same, male 31 years, now this PKU patient would be having 120 to 140% more than the suggested DRI. That is 120 to 140% more than 56 grams of protein, which is the PKU patient of the same gender age would be having around 67 to 78 grams of protein per day. Now, students, isn't it an irony? On one hand, you need high protein intake in your PKU patients. But on the other hand, you need low Phe intake. So how are you going to have low Phe intake and at the same time be providing high protein to your PKU patients? This is where two factors come into the PKU diet of a patient, which is in a PKU diet, 80% of the protein requirement is met via medical foods or supplements, and only 20% of protein in a PKU diet comes from dietary protein. And this is what the diagram over here is trying to show. That yes, the person may be having carbohydrate, fat, no problems, the person can metabolize it, but the 15% of protein which generally all of us on average have, right? When we break down the carbohydrate, fat and protein intake, right? So you could have maybe 65 and 15, 20, for instance. So in this protein, 80% of protein should come from medical foods and 20% from dietary proteins or intact protein. Remember, most important point, medical foods are phenylalanine free. That is 0% in your medical foods. Now moving on to intact protein first or dietary protein first. If you see the type of food sources that a PKU person can have in his or her diet, they are somewhat similar to a vegan diet, meaning they can have most fruits and veggies because we know fruits and veggies are naturally low in intact protein or dietary protein. But very importantly, what is different from a vegan diet is that food sources such as cereal, pulses, nuts, legumes, beans, which a vegan person would be having as a source of his or her protein, in a PKU patient, even these sources are considered as high protein and therefore they are restricted. Therefore, the dietary protein predominantly comprises of fruits and veggies. What else is available? So you have low protein modified foods available. Now these foods are particularly manufactured by various specialized food industries, and these foods are low in their protein and fat content. So for example, if you take pasta, the pasta which you and I would be eating from a regular store, it has approximately 1 cup cooked pasta has 324 milligrams of fat. But a low protein pasta will only have 15 milligrams of fat and not more than 2 to 3 grams of protein. Now, isn't that better? Because then the PAU patient can consume more amounts of food but yet not be worried about the fat intake in the food. Now, as I said, the main source of protein comes from the person's medical food. Now, these medical food, most importantly, they are phenylalanine free. They have all of the other macro and micronutrients required, vitamins, minerals, omega-3, energy, carbohydrate, fats, so on and so forth. Right? Now, these are available in various forms. They are available as powdered forms, which you mix with water and you have it. They're also available in liquid forms or in gel forms, which people can have it, and in various tastes and in various compositions. Now, yes, ideally, medical foods have to be taken throughout life, and how much the patient takes depends upon the growth cycle, life cycle that the patient is in, the protein caloric need, and the blood control that the patient is maintaining, the PKU patient is maintaining. Now moving to the last bit of the lecture, which is recent studies which we have done at the university, which is myself and my colleagues at Emory University. We have recently published a paper which could be of your interest, and I encourage you to read this paper. And one of the objective of this paper is about PKU and diet, and I'll be sharing only these results with you. I would also encourage you to try to summarize this research article according to the template which I had given you, where you can understand how do you critique a research article. Use those templates which were taught to you in summarizing these research articles, which will help you get into the habit of summarizing, critiquing, understanding research articles. Now coming back to the point, so in this study, we had studied adults who had severe and moderate PKU. Now these adults should be having approximately no more than 5 to 8 grams of protein per day, which is the intact protein that they're having from their diet. But what did our results show? If you see, on average, what was recommended to these adults was to have no more than 9 grams of protein per day. All right, but they were having approximately threefold more protein than they should be having from their diet, the actual intact protein, which is 25 grams. And this led to their fee intake of 1,250 milligrams of fee in their diet from their actual diet, their intact protein diet, and they should be having no more than 400 milligrams of fee from their diet, as you can see. And medical foods, relatively, they were quite compliant. The adult population was compliant with medical food relatively, but yes, their actual protein intake from their diet was much high. And because of this, when you read the study, you will see that their blood Phe levels were also very high because they were not having good control over their diet, over their intact protein from their diet. Now, this leads to the point of dietary compliance. This is very important, students, because with any other disorder, such as be it diabetes, hypertension, even inherent metabolic disorders, you need self-management lifelong. And for lifelong self-management requires health behavior change, whereas you are ready to make a change in your lifestyle, in your diet, in your health behavior. Therefore, a dietitian role revolves across the lifespan for a PKU patient, right from the infant being diagnosed with PKU, then going on to childbearing age, and then moving towards pregnancy and lactation. You need to maintain blood levels of individuals throughout their lifespan to have at the end not just favorable outcomes for the mother or for the population, but also in the future offsprings. Now over here, it is important to note that throughout the lifespan, yes, we require a good maintenance of blood Phe level. But now what is the role of a dietitian? See, this is what will set you apart in the real world, which is you not just having clinical competency of a dietitian, meaning what the patient should be having and how much the patient should be having. Any dietitian who is clinically trained will be able to calculate that. But what is going to give you your edge is you having patient-centric skills, meaning how are you going to convey to your patient to comply to your recommendations and your suggestions which you have given to him or her as a dietitian. And I want you to think upon this. I would encourage you and request you all to list down 3 strategies which you may use as a dietitian to encourage your patient to follow your dietary recommendation. Now remember, these patients do not have to be PKU patients, but these are your general competency skills which I'm tapping at. So let me know about 3 strategies which you think will help to encourage your patients to follow what you have suggested, and post this on the Blackboard discussion blog forum. Your next week's pre-readings are available online on the following link. And the next week's lecture is going to be on nutrition and hypertension. Now, the current lecture will be followed by a tutorial where we'll be having menu planning exercises for PKU and planning their medical nutrition diet therapy. All right, so these are your few references along with the pre-readings which are provided. If you have any doubts, please feel free to approach me. I have given you my walk-in hours, my telephone hours. You can always contact me, or you can also post your blogs or your doubts on the water cooler forum which I have developed online on the Uni online Blackboard. So please feel free to post your doubts on that, and I'll see you next week. Thank you.